Hello, my name is Dr. James Shamiyeh. I'm a pulmonary and critical care physician and also Senior Vice President and Chief Operating Officer at the University of Tennessee Medical Center. Today we're going to provide a COVID-19 update from the hospital perspective and also share some new information about the vaccines because there's been a lot of information released in the last few weeks and we want to make it as simple as possible to understand. So let's get started. This slide shows all COVID-19 patients in the hospital in our region, and our region is defined by all the counties at the bottom of this slide. The purple shows all of those patients, and you see that it has continued to drop, most recently 200 patients in the hospital at the far right-hand side. The red shows patients in the intensive care unit, blue patients on the ventilator, and those numbers continue to drop as well. This is information from our hospital. We have 27 patients with COVID-19 in the hospital today. And then on the right-hand side, the orange, we have 8 patients in the intensive care unit today. All these trends are favorable, and that's what we want to see. So I really now want to spend the rest of our time going through the vaccines. Several weeks ago, I presented a vaccine primer to try to make this easy and understandable, and there's been a lot of new vaccine information released since that time. So first of all, what does it mean to be fully vaccinated? So we have 3 different vaccines. The first point to highlight is there's one fully FDA-approved vaccine, and that's Pfizer for those who are age 16 and older. The other vaccinations are under emergency use authorization, and I've highlighted in yellow what is new. And you see just very recently, for those age 5 to 11, Pfizer has received an emergency use authorization that is at a lower dose, and that's the only dosing adjustment for those who are that age. So then let's just reiterate, what about severely immunocompromised patients receiving a 3rd dose? This actually has not changed at all in the last several weeks. And so for those who've received an mRNA vaccine, who have a qualifying condition, it's recommended that they get a 3rd dose at least 28 days after the 2nd dose. This is not considered a booster. This is a 3rd dose for a very specific patient population. Now let's talk about boosters. When I initially spoke to you a few weeks ago, it was only Pfizer that had received a recommendation for certain populations to receive a 3rd dose. That now crosses all vaccines. So for the mRNA vaccines, Pfizer and Moderna, a 3rd dose of any vaccine is considered to be appropriate for certain patients at least 6 months after the completion of the original series. For Johnson & Johnson, the Janssen vaccine, a 2nd dose, remember that one, it was only a single dose series. For that one, a booster is a 2nd dose of any vaccine at least 2 months after the completion of the original series. And so that's one of the differences. mRNA vaccines are 6 months. Johnson & Johnson is 2 months. Now, that may still be clear as mud, so let's go in a little more detail. For Pfizer and Moderna, a 3rd dose at least 6 months after the completion of the original series. Pfizer is the same dose, whereas Moderna is half dose. For Johnson & Johnson, it's a 2nd dose, and it's at least 2 months after receiving the first. And the dosing is the same as the original if you stay with the same vaccine. As far as mixing vaccines, because that's another option, any of the COVID-19 vaccines can be used for booster vaccination, regardless of the vaccine product that was used for the primary vaccination. But for the dosing interval, you should follow the recommendations based on the first vaccine you received, not the vaccine that you're necessarily boosting with. Okay, so then that's how the boosters work. Who should receive a booster? And this is where it also diverges. So if you received an mRNA vaccine, the recommendations are actually the same as they were before. And so per the CDC and the Tennessee Department of Health, there are different recommendations. Some should receive, some may receive, with should being a stronger recommendation. And these are really based on age and also based on underlying medical conditions. But for the Johnson & Johnson Janssen vaccine, the CDC recommends people 18 and over should receive a booster. Now, for those mRNA vaccines where underlying medical conditions are pertinent, this is the list of those underlying medical conditions, and this has not changed in the last several weeks. The question I get most commonly is, which booster should I receive? And as I've said, you may choose which COVID-19 vaccine you would like to receive as a booster. Now, there is some data about mixing vaccines, and there are people who are trying to, in the scientific community, arrive at an answer as to, is there some combination is best, but that's still very much evolving. And so instead of trying to get in that in this short video, I would just say, if you have questions, I would discuss them with your healthcare provider. So how do you find a vaccine? It's easy. Go to vaccines.gov, and you essentially choose which vaccine you're interested in, enter your zip code, and then multiple options close to you will appear. I looked this morning, and the website did not reflect the Pfizer availability for ages 5 to 11, but I anticipate or expect that it likely will soon. We've also heard that select pharmacy chains may offer vaccine to this age group, and so I would be watching for that. In our vaccine clinic, we intend to offer vaccine to those 5 to 11 years old. We've ordered that vaccine, which again is a different dose, and have yet to receive it, but when we receive it, we'll be posting those appointments or the appointment availability on our website. Let's not forget about the flu shot. Flu vaccines are very important this year. As COVID-19 cases and hospitalizations continue to improve, adding a bad flu season on top of COVID-19 could again overwhelm hospitals, and we don't want that to happen. So the flu vaccine is recommended yearly, not just this year, for everyone 6 months and older. You can get a COVID shot, whether it's a booster or part of the original series, and your flu shot at the same time. And we want to promote an initiative called Fight Flu Tennessee. On November 9th, all Tennessee County Health Departments are holding flu vaccine clinics. There is no appointment necessary, and for more information, you can visit this website. So if you're still not sure what to do about the vaccines, we just recommend that you ask your healthcare provider. So I'll now wrap up with a few closing thoughts. First of all, the COVID-19 data is definitely improving, and we don't feel that there's the need, at least in this format, to continue to provide data updates. Just know that we're closely watching the information, and if there is cause for concern, we will certainly let you know. On the other hand, we know that the healthcare delivery system has definitely been affected by what we've been through with COVID-19, and some of those effects are not immediately going away. But also the way that individual patients engage healthcare has been changed as well, and that's created some challenges. And so we're currently in conversations about how could we share information with you to help make that easier and really help to promote the health and wellness of the community as they try to get back in the habit of re-engaging the healthcare delivery system. So more to come on that. So I'll now close, as I always do, with the steps to end the pandemic. I'm not going to read through all these because I think everyone knows these, but I do want to point out that Knox County is still considered to be an area of high transmission. So we still need to be cautious, but with the numbers improving, there's likely some good news on the horizon. Thank you for your time, and we look forward to sharing more information with you in the future.